Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes once again. So we are doing the second speaking topic of the day, and that is how exactly the OET exam will come to you. अगर आप पूछते हो कि पेपर में कैसा पेपर आएगा, what would be kind of a speaking task that originally will come in the exam, it would be something like this. Everything will be given to you. So you are visiting a 90-year-old client who has lived alone, fairly independently for many years in a separate unit on a family property. मतलब अगर एक फैमिली प्रॉपर्टी है सो वो सेपरेटली रह रहा है, मतलब कि एक पूरी की फैमिली प्रॉपर्टी है, समझो कि इतना बड़ा घर है, दैट इज फैमिली प्रॉपर्टी. सो शी इज लिविंग इन अ सेपरेट यूनिट. सो वो यहाँ पे रहती है सेपरेट यूनिट में इंडिपेंडेंटली और अकेली रहती है. द फैमिली इज गोइंग ओवरसीज फॉर 2 weeks एंड योर क्लाइंट इज गोइंग टू अ रिटायरमेंट होम टू अवॉइड बीइंग आइसोलेटेड ऑन अ लार्ज प्रॉपर्टी. तो आप इतनी बड़ी प्रॉपर्टी पे इतनी सारी प्रॉपर्टी का कैसे ध्यान रखोगे? तो वो अकेली ना रह जाए, दैट इज वाई शी इज शिफ्टिंग टू यूर रिटायरमेंट होम. यू आर कंडक्टिंग एन एज्ड केयर असेसमेंट. तो सबसे पहले जब फॉरेन कंट्रीज होती है तो असेस करते हैं कि ये बंदा हमारे साथ रह सकता है या नहीं रह सकता. क्योंकि सोचो आप किसी को जबरदस्ती मतलब लालच में ले आए पैसों के लिए, उसको अपने रिटायरमेंट होम में ले आए और बाद में उसको सर्विसेज नहीं दे पाए, उसको संभाल नहीं पाए, और 90-year-old क्लाइंट है, अगर उसको कुछ हो गया तो who would take the responsibility? So that is why aged care assessment is very important कि उसको क्या बीमारियां हैं, what kind of medications is she taking, एंड फ्लेक्सिबल आवर्स, फ्लेक्सिबल रूल्स, उसकी क्या रिक्वायरमेंट्स है, आप पूरी कर सकते हो या नहीं पूरी कर सकते. तो ये बहुत इंपॉर्टेंट पॉइंट्स होते हैं. सो हमें सबसे पहला पॉइंट दिया है कॉम्प्लीमेंट द क्लाइंट ऑन पॉजिटिव एंड अनसेल्फिश एटीट्यूड. बट अगेन यहाँ पे ये तभी पॉइंट आप बोल सकते हो, दैट इज व्हाई आई एम पुटिंग इट इन द रिकॉर्डिंग. सो इफ दिस पॉइंट you do not understand, it is not necessary to speak. It is not mandatory to speak every point in OET. This is what I want to say. There is no deduction of points for not covering, but yes, speaking for 5 minutes is must. 5 मिनट आपको पूरे करने. रीएश्योर द क्लाइंट ऑफ प्राइवेसी एंड फ्लेक्सिबल रूल्स. क्योंकि उसको इंडिपेंडेंट रहने की आदत है तो उसको बताना पड़ेगा आपको कि आपकी प्राइवेसी मेंटेन रहेगी हमारे पास आने के बाद भी. एंड फ्लेक्सिबल हाउस रूल्स हैं, दैट मीन्स दैट you can enjoy there, you can feel at home, we will respect all your wishes, and you will have unrestricted visiting hours to meet the quality of life desires, which means that if you want to go out to meet your friends, you will be having unrestricted visiting hours. That means you can go at night as well. Daily routines that you can sleep your, I would like to ask you about your daily routine, sleeping habits. कितने बजे आप सोते हो, आप कैसा खाना खाते हो? See, we are noting down all these points of your daily routine to make a care plan for you so that we can give you all the facilities. That is why we are asking you these questions, and as you are answering we are noting down all the points. Apart from this, are you having any disease for which you are taking medication? Like, do you need any support? No nurse, I do not need any support. मैं medication अपने आप ले लेती हूँ. अगर वो कहे तो कहो, don't worry, we will provide a nurse who will take care of your medication. या social worker. Summarize your discussion and assure. Summarize कम in OET speaking there is special marks for reassurance. अगर आप reassure नहीं करते तो marks deduct होते हैं. So I would like to summarize that there is nothing to worry. Whatever things you need, like flexible sleeping hours, unrestricted visiting hours, you will get all these things. Unrestricted visiting hours also means that anybody can come to visit you as well. So we do not have any problem. Also, the kind of food you want to eat, you will get that kind of food. So, and assure the client that you will pass on his her contentment, means satisfaction with the arrangements to his her daughter. That basically this point is little difficult to understand. So they are saying that we will pass that you are satisfied with the arrangements. That means you are satisfied with our policies. So we will pass on this consent or a contentment to your daughter, that we will inform your daughter that you are happy to shift. So this is what this point means. Again, अगर आपको समझ नहीं आया तो मत बोलो, समराइज कर दो और रीएश्योर करो, ठीक है. लेकिन थोड़ी सी कोशिश करोगे तो पढ़ो, देखो, that you will pass on her satisfaction with the arrangements. कि satisfaction with the arrangements, ये with इसके साथ ही लगा है कि arrangements के साथ आप satisfied हो, ये हम पास कर देंगे to your daughter. So that is what this point means. थोड़ा सा कोशिश करना पेपर में अगेन. सो अब मैं आपको बोल के दिखा देता हूँ. ऐसे ही टास्क आएगा पेपर में, ठीक है? सो अब मैं आपको अच्छे से बोल के दिखा देता हूँ. Good morning, my name is Bhupesh and I am a nurse. I have come to pay a home visit to make an aged care assessment. As I have been told, ये बड़ा इंपॉर्टेंट है. यहीं पे ग्रामर टेस्ट होती है, वही पैसिव वॉइस जो मैं आपको डेली सिखाता हूँ. जैसे कि आपको मेरे द्वारा, जैसे कि मुझे बताया गया है, पैसिव वॉइस, मुझे बताया गया है. As I have been told that you want to shift to our retirement home because your family is going abroad. Am I right? तो कहेगी yes. Also, you are living on this property alone and fairly independently. So you are thinking to shift just for 2 weeks because your family is going. तो वो कहेगी हाँ जी. वो कहेगी, तो वो कहेगी yes. तब यहाँ पे वो कहेगी yes, I am shifting. यहाँ पे उसको, यहाँ पे आपको एग्जामिनर पे थोड़ा डिपेंडेंट रहना पड़ता है. अगर वो नहीं बोलता फिर आपको ये पॉइंट डिडक्ट करना है कि आई अप्रिशिएट कि आप बड़े अनसेल्फिश हो. लेकिन उसको ये पॉइंट बताना पड़ेगा ना कि अगर मैं शिफ्ट नहीं करूंगी तो मेरी डॉटर परेशान रहेगी. इफ आई विल नॉट शिफ्ट, माय डॉटर विल बी डिस्टर्ब because she will think कि how would I survive in this big unit, in this large property. So that is why I am shifting, so that my daughter can enjoy her 2 weeks of holiday. तो ये बात जब वो बोलेगी तब आप कहोगे I really appreciate that your positive and unselfish attitude. फिर ही बोलना आपको, नहीं तो ये पॉइंट नहीं बोलना. इसीलिए कहता हूँ कि व्हेन ओईटी में आपको राइटिंग में कुछ समझ नहीं आ रहा, स्पीकिंग में कुछ समझ नहीं आ रहा, उसको गलत बोलने से अच्छा मत बोलो. दैट इज व्हाट वी आर टीचिंग यू अगेन एंड अगेन. उसको बताना है कि फ्लेक्सिबल हाउस रूल्स हैं, क्लाइंट्स को फील एट होम करवाएंगे. ये सब पॉइंट्स मैं आपको बोल के दिखा देता हूँ. सो गुड मॉर्निंग, माय नेम इज भूपेश. आई एम अ नर्स ओवर हियर. आई एम अ नर्स एंड आई हैव कम टू पे अ होम विजिट. आई एम अ नर्स and I have come here to pay a home visit as I have been told that you want to shift to our retirement home for 2 weeks as your family is going overseas. Am I right? Yes, nurse, but it is not necessary. First of all, I would like to get the satisfaction. Only then I would shift to your retirement home. Well, that is for sure. I will tell you each and everything about our retirement home. We are very welcoming and we assure you that we will welcome you very warmly when you will come to our retirement home. But nurse, I don't know. I just don't want to shift because I am independent and I am living alone, as you can see, in a separate unit. But this is a large property. So I want my daughter to enjoy her 2 weeks. That is why I want to shift. Otherwise, I can stay here. See, I really appreciate your positive and unselfish attitude towards your daughter and towards your family. So don't worry, you will get the best in our retirement home. So I reassure you that we will maintain all your privacy like you are maintaining over here at your home. And also you will have the flexible house rules. So we provide all the convenience to our clients. Oh, well, that's nice to know, nurse. So I would like to ask you, can you provide me homely environment? Like, would you follow all my instructions, whatever I need? And would I have, normally I go out and come, sometimes my friends come, though they are very aged, but sometimes they come late. So is it all allowed at your retirement home? Well, yes, of course. See, I would like to tell you about my home's policies. See, first of all, we will make you feel at home and we will respect all your wishes. Also, I would like to tell you, as you want unrestricted visiting hours, so definitely you can go out anytime and also anybody can come to meet you and to see you anytime. So you will have all unrestricted flexible hours. Apart from this, I would like to tell you about the sleeping habit. I would like to ask you about your sleeping habits. So what time do you like to sleep? Oh, nurse, it is not necessary. Again, as you know, I am independent. Sometimes I sleep at 9. Sometimes I keep on reading and, listening to some music. Sometimes I sleep at 11. So, and what kind of food do you take? See, as I don't have my permanent tooth now, so I have dentures, so I do not eat very hard food. I would be requiring mashed potatoes and all that soft foods and liquid diet. Okay, so see, as you have told me that you're sleeping as per your choice. So we will give you that flexibility of hours. There would be no restrictions. Also, the kind of the food like mashed food and all those food would be provided to you. I have noted down in my diary as your daily routine, and we will create a plan according to your choice. How does that sound? Well, that sounds all good, nurse. Well, that's great. And also, I would like to ask you about your medications. So do you take your medications? What kind of medications are you taking? Nurse, I'm 90-year-old, but I do not have much medications. There are a couple of medications which I take for my blood pressure, but I can take it myself. Well, that's great, but still we will provide you a social worker who will be there to assist you to follow your regime if required. All right, nurse, that's great. Okay. And now I would like to summarize our discussion that you would be having unrestricted visiting hours. And also I have noted down that you sleep according to your wish, and the meals that you need is kind of soft food or the liquid diet. And I reassure you that everything would be flexible over there, and we will respect your privacy, and flexible house rules would be there. Okay, nurse. Well, that's fine. Then I'm okay. You can pass this information to my daughter that I'm happy to shift. Well, that's great. So I will pass this information to your daughter. And I reassure you, there is nothing to worry. We all will be there to help you. And our house has got good staff. They all will help you in the best possible way. All right, nurse. Thank you. Okay, take care. So that is how you do your task. So this is all. That is how easy you can make it. Again, मैं कोई टास्क अच्छा नहीं कर रहा, आपको बार बार बता रहा हूँ. आपको सुनने में अच्छा लग रहा है या बुरा लग रहा है, या मेरे से एक दो फंबल हो जाते हैं. फंबल तो सबसे होते हैं. हम जब अपने पेशेंट से मिलते हैं तब भी तो फंबल होते हैं. वो प्रॉब्लम नहीं है. आपका कॉन्फिडेंस टू कैरी, आपकी हैबिट टू स्पीक इन इंग्लिश विल हेल्प यू. दैट इज व्हाई आई एम एनकरेजिंग यू ईच एंड एवरीवन. हमेशा हमारी एक ही बात रहती है, प्लीज ट्राई एंड टॉक इन इंग्लिश, प्लीज ट्राई एंड टॉक इन इंग्लिश. दैट इज द ओनली way to improve your speaking. There is no other way. जब छोटा बच्चा होता है हम उसको कैसे सिखाते हैं कि वो कैसे सीखता है. It's just about talking continuously. हम उससे communicate करते हैं, हम उससे पूछते हैं, baby do you need this thing, do you want this thing, तो वो भी थोड़े दिनों में बोलने लग जाता है, do you want this. So that is how we will learn as well. और हम बच्चों से तो strong capacity है हमारी सीखने की. बस अगर कॉन्शियस माइंड में नेगेटिव थॉट्स ना आए तो हम बच्चों से जल्दी सीख सकते हैं. हम बड़े हैं यार, सीख ही सकते हैं. सिर्फ कॉन्शियस माइंड तंग करता है हमें. सो रिमूव दीज क्वेश्चंस एंड एंजॉय स्पीकिंग इंग्लिश. आपको कंफर्टेबल हो जाओगे, आसान लगेगा. सो दिस इज डॉक्टर भूपेश वंस अगेन फ्रॉम डॉक्टर बीकेएम इंस्टीट्यूट्स. नाउ आई विल टेक योर क्वेश्चन. आवर कॉन्टैक्ट नंबर इज 7696734256. थैंक यू.